All right, thank you guys for joining us. I am here with Christy Burns, founder and president of Every Mother Counts. Thank you so much for joining us, Christy.
Thank you. Wonderful to be with you.
So tell me a little bit about the desire to want to start Every Mother Counts, and specifically this film series. Tell me the idea behind it and the desire.
I started the organization in 2010, but my story and my connection to maternal health and my commitment to this issue really goes back much earlier. I became a mother in 2003. I delivered my first child, my daughter, Grace, and I experienced a postpartum hemorrhage on that day. And so I like to say that I became a global maternal health advocate the day that I became a mother.
Can you talk about why it's so important for women to feel seen and heard and to have an advocate?
Becoming a mother is one of those experiences that I think in the media and film we kind of glamorize and or we show in less than wonderful sort of outcomes. And I think it kind of comes with it a sense of fear, natural for the unknown, but also just a lot of pressure, I think, to behave in the way that you've seen portrayed in film and in the public arena. And so I think what's most important and what I learned so strongly when I was going into the experience myself was that when you're coming into this stage of your life, there are a lot of questions you have. It's so critical what sort of state of health you are in before you become a parent. But oftentimes, I think more than 50% of pregnancies in the world are unplanned. And so being at your optimum health in those early days is so essential. I think the advocacy piece is usually, a mom kind of asking questions, hopefully having a partner and a support system at home, but also in the care providers that we have available to us. And there are a range of providers that exist out there who are committed to ensuring safe outcomes for both mom and baby. And I would say that those medical professionals can tend to be advocates for moms as well, as long as they've been able to spend the time and get to know one another and sort of build that trust that comes from a patient-provider kind of standpoint. If we don't have those support systems in place, it's really hard to advocate for ourselves. It's very hard to go into a hospital setting where it might be the first time we've ever been in a hospital or a clinic setting and have something be confusing or painful or not explained correctly. And so to have someone who's there to support the mom throughout the process, but especially when and if she's not able to advocate for herself, is so essential. And so we really look to doulas and community health workers and nurses and physicians to sort of step up into that role in addition to family members and support systems at home.
When you look at history and, different social factors, sometimes women can be less inclined to want to advocate. So how do you feel like healthcare providers become advocates as well and better bridge that gap to make expecting mothers feel comfortable when in terms of advocating for themselves?
Oftentimes, providers who have gone through the experience themselves might have that added knowledge or insight as to what is needed or required or looked for in the process. But I would say it's really that commitment to the patient, really, to understand that we all come from different kinds of situations at home, and there is a lot of fear in our medical institutions, particularly around an issue such as maternal mortality, which has over the last several years become a bit more talked about in the media. But I think from a perspective of more fear-inducing, right, and less empowering. And so I think, early on when patients are meeting their providers and maybe starting to talk about what their hopes and wishes are for the pregnancy and outcome, I think in those conversations as a provider, also being a good listener, I think we need to listen to women in this state to the extent that, it's a relationship which requires both the mom as an active participant in the experience, as well as the provider who has expertise and a lot of experience with a lot of different kinds of birth experiences. And so, yeah, it's building a relationship. I think that's really critical, but letting every mom know that she does know her body well. And as long as she's supported and does feel heard and can ask any question, like literally can ask any question, I think those are ways that we can sort of build that sense of comfort and also education that's so necessary throughout the process. I mean, there's so much that we don't know about our bodies and about pregnancy, even though we've been around it and even though it's been happening since the beginning of time. It's actually surprising how little we ultimately know. And so I think asking questions and feeling safe to ask any question is really important.
Why focus on Arkansas? And I watched the film series myself and followed those three mothers from a variety of backgrounds, different races. So tell me, why you guys chose Arkansas and specifically the demographic that you guys were looking at.
I launched the series Giving Birth in America back in 2015, late 2015, going into the election of 2016, and really as a hope to elevate maternal health as a topic during that election year. We have made 7 films to date, and Arkansas really came to the top once it received this not wonderful ranking in terms of maternal health outcomes across the country. So that was the real impetus in why Arkansas, why now. I think there's a tremendous opportunity in Arkansas to elevate this issue, and I've already started to see a lot of conversation coming out around the state since this ranking was bestowed. The hope with this series is to bring about challenges, but also solutions that could positively improve the outcomes of both moms and babies and families ultimately across the different states, which each are very, very different. I often will say that our 50 states could be 50 different countries in many respects, and they behave differently. They legislate differently. Yet the experience of giving birth and becoming a mother is pretty consistent across most of the states and actually around the globe. And so to address things like distance as a barrier, or access to quality care or respectful care, or information and resources that would help to inform and better prepare a mother for childbirth, all of those things I would say we've kind of rallied around throughout each of the films, but this one this one specifically in Arkansas, we're really looking at that postpartum period. One, because it's become much more clear and evidence-based that 30% of maternal deaths in this country happen in the postpartum period, the late postpartum period, after 6 weeks postpartum. And so because of that, it allowed us to put a frame on maternal health, on parental leave, on some of the other factors that make that postpartum period especially challenging for many moms and families. And so really what these films do are elevate some of the stories and hope to open the conversation up to be able to focus on solutions, which we've sort of laid out pretty clearly in the film in the sense of extension of Medicaid postpartum for a full year, which is what most of the country has signed on to do. When we finished the film a year ago, just 30 states had extended Medicaid coverage. And as of last week, I think we're up at 44 states. So we're getting there in that sense. And the important factor about that is just educating people. We weren't talking about postpartum as a place of danger, right? The focus has been for many, many years on prenatal care and on delivery care. And yet the numbers have shown us that many of the preventable deaths are happening in the late postpartum period. And this is a real opportunity to shed more light and focus on that period of a mom's life so that we can ensure her safety.
Governor Sarah Huckabee Sanders here in Arkansas has recently created a committee that will focus on a statewide maternal health plan for mothers. But when we take a look around the country, and you talk about it in the film, just extending that paid leave for mothers, is there anything beyond, when you take a look at legislation, is there anything beyond that? Maybe that's additional resources for hospitals, or anything that can be provided to continue to create a safe space for mothers. Is there anything beyond that that you're saying, this needs to happen, it needs to happen now, and this is the time to take a look at that?
I mean, I think it's very, very promising to hear the leadership and the political will coming from the governor with this order. I think what's been called out has been this need to bring all the stakeholders together: the hospitals, the insurers, the families, the individuals themselves. Like, there are a lot of factors at play here. I think resources wise, yes, there are many more resources that are needed, but I think really the connecting of the dots so that it doesn't feel so challenging or so isolating to be a mother who's in need of services, right? So if there is a mental health issue or a pre-existing condition, a chronic health challenge, these moms need to have a better sense of where they can get their care met and their needs met throughout the continuum of care, right? From prenatal to delivery to postpartum. And I think that awareness and that making things clearer for moms and patients is a very big step. Looking at the maternal mortality reviews, understanding and learning from the cases that have happened that we weren't able to avoid, to improve future births and outcomes for more moms and families.
Thank you so much for taking the time to speak with us about this important topic. You enjoy the rest of your day, but thank you so much for making the time.
Thank you. Take care.